Welcome to the MedFlashGo podcast. This is your 4 minutes or less rapid review for USMLE, Comlex, and shelf exams. Let's get into the episode for today.
Hey folks, this is Sean. I'm a third-year medical student interested in cardiology, possibly invasive cardiology. And let's just get right into the question today. So, a patient is 10 days post-inferior wall myocardial infarction. What can be seen on a light microscope if a sample of tissue is taken? A. Inflammation with neutrophils. B. Coagulative necrosis. C. Extensive fibrosis. Or D. Macrophages. And the answer is D. Macrophages. So days 3 to 14, macrophages are going to be seen, then granulation tissue at the margins. This is very high yield for step 1. As you know, or as you may not know, pathology is the highest yield for step 1. The evolution of the myocardial infarction is as follows. So ischemia leads to early coagulative necrosis with the release of necrotic cell contents into the bloodstream within the first 24 hours. You want to remember that these necrotic cell contents are going to be your troponins, your CKMB. Then between 24 hours and 72 hours, tissue surrounding the infarct shows acute inflammation and neutrophils. Keyword there is the neutrophils. Then between days 3 and 14, as we said earlier, macrophages begin to show up with granulation tissue. And the macrophages in this phase are going to be responsible for what potential complication? That's going to be your free wall ruptures or your papillary muscle ruptures. And this is due to the degradative process initiated by the macrophages in this, inflammatory response. So let's go over again this timeline here because I want to reiterate this is very important. So first off, you're going to have the early coagulative necrosis with the release of necrotic cell contents. And then you're going to have the acute inflammation and neutrophils between 24 and 72 hours. And then between days 3 and 14, that's where you're going to have the macrophage phase with the granulation tissue.
These questions are powered by MedFlashGo, the first voice-based interactive medical question bank currently available on Alexa. To get access to your first 50 free questions, go on to your Alexa application and search MedFlashGo in the skills section. To learn more details, go to MedFlashGo.com and check out our frequently asked questions section. These questions were creatively designed by medical students and physicians for the purpose of education and does not replace health information given from your health professionals. We have tried our best to make sure the information is accurate, so please let us know if you find any errors and we will be sure to correct them.